Good afternoon, everyone. My name is Dr. Michelle Meggs, and I serve as the Executive Director of the Women and Girls Research Alliance. And I want to welcome you to our October Research and Practice Discussion Series. The topic for this month's discussion is prioritizing women's mental health during COVID-19. We are absolutely in for a treat this afternoon with our esteemed panel. I will introduce them briefly. Our moderator for this afternoon is Dr. Sonyia Richardson with UNC Charlotte, Dr. Erica Lennon, also with UNC Charlotte, Dr. Alicia Dahl with UNC Charlotte, and also Ms. Tchernavia Montgomery, who is the Executive Director at Caring. So I promise you that this discussion will be informative, it will be enlightening, and I believe that once you leave this discussion today, you will also feel empowered. Please note, you are welcome to post your questions in the chat, and the panelists will address your questions. Also, towards the end of the discussion, a poll will pop up on your screen. It'll be no more than 3 questions. We ask that you will take our poll towards the end. Also, we will raffle off care boxes. So everyone who is involved in our discussion today will automatically be entered in our raffle for a giveaway of a self-care box. So with that said, I am more than happy to turn it over to our moderator, Dr. Sonyia Richardson. Dr. Richardson.
Good afternoon, and it is indeed a pleasure to moderate this panel. I'm happy to be among some esteemed panelists and to share about women's mental health during the COVID pandemic. I would like to thank Dr. Meggs for this opportunity and also Taylor for your support. So for most of us, the last 19 months have been an emotional roller coaster, to say the least. And if we were to admit it, most of us have dealt with mental health challenges during the pandemic and questioned our own sanity and if we were well. This is a result of the additional worry about our aging parents and or family members and their safety, additional worry about our children and their learning, relationships, and development, additional worry about being able to pay our bills, afford childcare, and meet basic needs, additional worry about decisions with vaccinations, COVID-19 tests, and the slightest snuffles we hear from ourselves or other family members. We've had to change our interaction with our social supports, including our gyms, our places of worship, and our community outings. And some of us, unfortunately, have endured the loss of friends and family members as a result of COVID. We have endured much in the last 19 months. Not only are we dealing with the impact of COVID, but also inequities. According to the North Carolina Council for Women 2020 report entitled Exploiting Inequity, a Pandemic's Gendered and Racial Toll on the Women and Families of North Carolina, it was affirmed that the onset of the COVID-19 pandemic exacerbated inequities in North Carolina, specifically for women. This included the disproportionate amount of women in essential workforce positions, spikes in our unemployment rates, also increases in domestic violence, and the strain that we experience of balancing or either sacrificing our careers in order to parent and assume caretaking responsibilities. In addition to being in a pandemic, as women, we have endured inequities. And for many of us, we are emotionally and psychologically exhausted. But there's hope. This report also acknowledges slight improvements that have been made as a result of the pandemic. For some, it suggested a general slowing down of the pace of life and greater work-life balance. Additionally, the use of technology, even with our event today, has allowed for more healthcare services, social connections, telechurch, and telework opportunities, increasing flexibilities. Many of these changes have helped to promote work-life imbalance for many of us. Today, we prioritize women's mental health during COVID-19. We will touch on what's working, what's not working, and how we can support and uplift each other. In today's discussion with our esteemed panelists, I'm sure we will also educate and inspire you. So without further ado, let's get started with our panelists. So we have 3 panelists with us today: Dr. Lennon, Mrs. Montgomery, and Dr. Dahl. We are excited to have each of you with us today, and welcome to our panel. So mental health is defined as a person's condition with regard to their psychological and emotional well-being. So are you psychologically and emotionally well, is how mental health is defined. So the first question I have for the panelists, and we'll start out with Dr. Lennon, if that's okay. The first question I have for you is, as professionals and experts in your field, how has the COVID-19 pandemic affected women's mental health?
Yeah, thanks, Dr. Richardson, and thank you for that intro. I think you really summarized like a lot of the key components that have affected women's mental health. And so I think the short answer is it has not affected it well, as I think all individuals, regardless of gender identity, have been impacted. But I do think women, because of particular in employment that we have, because of policies and procedures that do not work in our favor, because of ways we are socialized, is a lot of this stuff has stacked up and it's just led to really kind of an onslaught and an attack of mental health for us. I know we'll talk about this later, but I do think that the intersecting identities within that, so looking at Black, Indigenous, and other women of color versus white counterparts such as myself, there are disproportionate rates there. Looking at queer and trans women versus cisgender straight women, there are absolutely disproportionate pieces there that I'm excited to get into as well. The biggest piece for me and my work as a psychologist that I have seen is really related a lot to the socialization piece of as women and messages that we get growing up and as we get into adulthood. There's this constant piece that talks about that women can have it all and need to have it all, is we need to have the family, the relationships in the way that we want and the way society expects, and we need to have our jobs and our career. And I do think in some ways that this socialization sets us up to not be able to meet those expectations and to feel very disappointed in ourselves and feel guilty for not being able to meet them. I know as a woman identified person, I can absolutely relate to that. In this pandemic, balancing my job here at UNC Charlotte and my little one that I have at home has been one of the most challenging things I have ever gone through in my life. And I have not been able to do it in the way that I expect myself to. And I have gotten very down on myself because of it. And so I do think that these self-expectations play a major role, and they come from, again, the socialization expectations that others put on us to be able to do all these things in the way that we are expected to.
Yes, thank you for those comments. You kicked us off so well with that, and you're right. The socialization and digging deeper into that, and the whole notion that we believe and have been trained and taught that we can do it all. One thing I've focused on as a therapist, as a mental health therapist, one thing I've focused on with some clients that I've worked with is giving ourselves grace during this time period, and grace is almost a form of resistance for the socialization and thought that we can have it all. So thank you so much for sharing that. We're going to get deeper into that. You dropped a lot of nuggets there. So thank you so much for that. Let's move next to Dr. Dahl. Could you respond for us next? So how has the COVID-19 pandemic affected women's mental health?
Sure. Hi, everyone. My name is Alicia. I work here at UNC Charlotte in the Department of Public Health Sciences. So the pandemic is my space, right? And what I've seen kind of just across the board is, remember going back to March 2020 and that emphasis on essential workers. And I think what might have fallen through a lot of those cracks in the messaging around our healthcare workers and our grocery store workers is that majority of that workforce is female or women identified individuals. And so in the hospitals, so in the health system, there's nearly 80% of the workforce is women in this country. And then globally, it's about 70%. And then in the space of pharmacies, again, above 70%, and in the space of grocery stores, above 50%. So if we go back to responding to that kind of that automatic shutdown and pause on life, those have ripple effects. And then we've gotten back into this space where things are getting back to normal, so to speak, but are those spaces actually normal? And so as women are going back to those workforce spaces, how has the dynamic of those spaces changed? So that's one area that I think is important to frame the conversation. And then the area of research that I'm focused on is in pregnancy and postpartum. And although I work with pregnant and postpartum women, and I can expand on what the impact has been in the mental health space there. One thing that I've personally noticed throughout the pandemic is how my non-maternal friends and colleagues responded to a space where their social relationships changed. So dating and finding those romantic relationships or those functional relationships that, again, we are socialized to experience can also affect somebody's mental health when they don't have the same opportunities to do so.
That's awesome. Thank you for sharing that. And I love your thoughts about the overrepresentation of women, especially in those critical essential workforce positions, and how that's played out and digging deeper into that. And so glad that you have the background and experience with pregnant postpartum women, because that's a totally different, totally deeper, I would say, issue as it relates to COVID. And we know that those inequities have been exacerbated with that population as well. So we're going to dig deeper into that too. You guys keep adding topics to this conversation for us to dig deeper into, and it's exciting. So thank you so much for that. So last but not least, would love to hear from Ms. Tchernavia Montgomery, one of my favorite superstars. Could you tell us a little bit about how the COVID pandemic, from your perspective, has affected women's mental health?
Absolutely. So I will start this off by saying the pandemic coincidentally coincides with the anniversary of the 19th Amendment, when women were given the right to vote constitutionally. So this disruption, I think, is poetic in a sense, but not in the best way. I think that as women, we have had a heavier hit related to the economic impacts of COVID, because we naturally juggle multiple competing priorities, right? We're wanting to be employed, we are working mothers, we are caretakers for other adults that are aging. We know the boomer population is growing. We want to have a social life, right? We want to give ourselves grace to do things that we actually enjoy or find pleasure in. But all those things we're having to compartmentalize, and it's tougher with some things having a heavier weight than others. Specifically in my area of employment and area of study, I'm looking at low-income women, and they have taken a bigger hit for unemployment during the pandemic because of a lack of childcare and not having the social capital that women with other means have experienced or have. So they are having to reduce their hours more frequently, leaving their jobs entirely. High quality childcare is very difficult to find. I think as a county in Mecklenburg, we've done a much better job in the recent years to make more high quality childcare accessible. But for women that are in pink collar occupations, that's what it's been coined, those that are in frontline or essential worker jobs, it has become a bigger challenge. You know, that half of women in low wage jobs are women, or people in low wage jobs are women. And they're earning low wages. I think approximately $11 an hour was their average earnings. And that is even more disproportionately higher for women that are Black or in the Latinx community. So we know, because of things like structural racism and poverty being perpetuated, that their challenges have only been heightened. I think the pandemic has absolutely brought about some illumination for us with challenges that we know in the human services field were already there. But the anxiety is higher, the depression is higher. All of these things are being found through actual measurable means. So I'm hoping we will continue to work towards solving these problems, but it's tough. Whether you have a college education or you have a GED, the pandemic has impacted our mental health overall.
Yeah, thank you for sharing that. And thanks for that perspective in focusing on low income women who are experiencing lower incomes. And so I think that's also definitely a topic we want to make sure that we tackle today as well. And so you all have really opened conversation on how it's affected women's mental health, and just wanted to narrow in just a little bit more. So it sounds like from each of you, you've discussed some social issues that have impacted some of the issues that have been experienced. And then Dr. Lennon, you started out speaking about socialization of women and how those have contributed to some of the issues. So let's talk through this socialization process a little bit more, particularly as it relates to mental health, and how that socialization has either supported or not supported our seeking services and supports for mental health. So Dr. Lennon, could you just dig deeper into that socialization area for me? It sounds like that's an area of research for you, and I'd love to hear just a little bit more about your thoughts regarding that and how that's coupled with COVID.
Yeah, absolutely. Definitely an area of fascination for me. I love looking at the messages that we receive and how that aligns with the sort of multifaceted nature like of our identities. Yeah, I mean, again, the socialization part, I know, is something that starts from minute one when we're born. The identities that we carry into this world, the identities that people perceive, people start that interaction from moment one about how they treat us. And we know this. We know that, for example, the very first question that most new parents are asked is not, is the baby healthy? It is, what is the gender? What is the sex of the baby? And so it literally starts this process of us configuring in our minds, depending upon what gender, for example, that the baby or sex the baby is assigned at birth, then we attribute all these hosts of fantasies of what their life is going to be like and different attributes that they're going to have and what we actually expect of them. So I think as women identified individuals, I think we get a lot of messages, as I mentioned before, about having it all. But part of that message is the idea that has to do a lot with what was named with this caretaking piece. So caretaking of children, which was named, caretaking of other adults, which was named as folks age, particularly as was mentioned, the boomer generation. What to me that this leads to, and I think Mrs. Montgomery, you sort of named this as well, is this idea that if we want to have a social life, and if we want to engage in self-care, that becomes an afterthought. And we are socialized to believe that that's an afterthought, that self-care becomes seen as a reward. If we get everything else done, if we do what we need to do for our job, if we do what we need to do for our family members, other people that we might care for, our religious communities, our other circles, that we volunteer in, then we can have time to self-care. And I think when self-care becomes seen as an afterthought or as a reward, it never gets consistently integrated. And instead, as women, I think the challenge I would put forth is, how do we see this concept of self-care becoming not a reward or afterthought, but how do we see it becoming something that is an essential integration of our daily routine and who we are. And I will say that is on us as women to do that, but I will also say that is not where it ends. The one thing I've recently been really wrestling in my own head is, what are the systems and organizations' responsibility to build in self-care for women and for other individuals with historically oppressed identities? Often we hear organizations say, take care of yourself, self-care. And it's like, well, your organization is not systemically set up to allow that to happen. And so we are putting the responsibility on the individuals to do that for themselves. And as system, we are not creating policies and procedures that also foster that. So I think we also need to see a system responsibility in challenging some of those messages that are sent to women.
That is so good. Yes, I love all of that. And you're absolutely right. The whole idea of self-care being something that should be required, mandatory. It should be one of those tasks on our checklist. And oftentimes we are conditioned to wait until we've checked off everything. Once we've gotten through all of our duties for the week, then we can decide to focus on self-care and relegate just a little bit of time to it, because then we have other tasks we need to take care of. And so I think you're definitely right, like being able to integrate that and making sure, as suggested in the past, self-care is an act of resistance. And so thank you so much for sharing that. That lends into what Dr. Dahl was mentioning earlier with, you had given examples of those of us who are maternal and have maternal responsibilities, and those who do not, and trying to engage, and socialize in those spaces. Can you speak a little bit more to those differences and experiences and what you're seeing as it relates to COVID-19 for women who are in those different areas and domains of their lives?
Certainly, thank you. So I think one of the first things I want to touch on, and then I'll get into the maternal side of things, is also in addition to kind of the self-care, this work-life balance that we're constantly striving for, but the word balance in and of itself is setting us up for failure, right? And so it's more about how do we work in the time and the priority to have more life happening in a way that's maybe not 50-50, but it is providing us the opportunity to engage in fulfilling opportunities. And so I do think that the pandemic kind of jolted us into this space where we realized how much women were doing from that socialized standpoint, that caregiving for women who had young children, then they're maintaining their jobs, and they're also, doing some of this homeschooling. And so it kind of, I think, shocked a lot of employers and a lot of folks maybe without children into the reality of what all those responsibilities look like. And so with motherhood, what I've seen is that working with pregnant and postpartum women during the pandemic, social support is so crucial during that motherhood experience, whether it's labor and delivery, whether it's postpartum, whether it's the pregnancy experience itself. And the pandemic really cut off a lot of those social opportunities for women. One kind of hard example is that the policies of hospitals changed. So women who were expecting and were, had labor and deliveries scheduled within the time of the lockdown, their whole experience was shaped differently than what the normal experience was or what they had hoped their experience would be. And so when the hospital limits how many people can be visiting you in that space, when there's certain requirements around when visitors can be in that space, it kind of just creates a detachment. And then there's this whole other layer of now you have an infant that you're trying to care for, and social support can be so important during that time. But many women felt that they had to put up strong boundaries with receiving some of that functional and emotional and belonging support. And so because of the risk of the virus, a lot of women were not allowing family members into their space during that really important time. And so you're seeing an uptick in postpartum depression, which is maybe not because of hormonal imbalance, but also this social imbalance that they're not having in a traditional normal pregnancy and postpartum experience. So there's a lot going on there. And then I've also seen anecdotally, folks who are not maybe caring for young children are then doing more of the caretaking for their parents. And so there's been a shift in kind of who's taking on those roles. And in some situations, there isn't that flexibility where somebody is only focused on children and somebody is only focused on, aging parents or ill family members. And so that, I think, is important to remember too, is it is sometimes considered a privilege in this country to be able to step in and support family members in different ways. But sometimes that privilege does not exist. And so for many people, they're just taking on so much of this. And for women specifically, caretaking tends to be the socialized responsibility in a household. And so those are just important considerations to think about.
Thank you so much for sharing that. And you bring up some great points. So we go from the shift in support, so how our entire support systems have shifted and we show up differently in those spaces. And then Dr. Lennon also talked about the need for self-care. So making sure we create that time for self-care and make that a priority. And then Dr. Dahl, you left off by talking about privilege and how some of us are privileged to show up differently and how we support others. This this links us down to, to Ms. Montgomery in your work with working with women who are low-wage earners or focusing on that population. Can you talk a little bit about privilege during COVID, particularly for women, and how that affects mental health, what we're seeing there?
Absolutely. So I think I got to put in my social work hat, talk about poverty, right? Lack of access to resources, lack of access to care, things that you or I could easily obtain via our health insurance cards or via just resources, right? Social capital in itself. So we know that that lack of access to healthcare is a symptom of poverty. We could go on a whole other binge talking about health equity in our city, our county, and how disparate it is just based on where you live and your zip codes. We know that there are 6 zip codes in Mecklenburg County that they're called the priority health zones, and they sort of encircle our center city area. And within those areas, we're going to see higher rates of chronic disease. We're going to see higher rates of mortality, higher rates of substance use, lower income, higher rates of mental health, including higher instances of stigma, where obtaining mental health services is not the norm, and there's still a negative light shown upon mental health in general. So we know with all of those things in consideration, we're going to get poorer health outcomes, right? And this is a generational impact. We've got things like genetic predisposition and health behaviors, medical services, and the environment you live in, but only 80 or 90% of that is actually non-medical. Or 80 to 90% of it is non-medical. So we've got a lot of things that COVID has impacted us around that are non-medical factors. We all have seen food shortages. We've seen higher gas prices or higher food costs. We've seen our childcare hours may have varied, right? But for those of us that are on this call, we may have had the ability to say, well, I'll just work from home. I know personally, we doubled our Wi-Fi bandwidth, make it easier for the kids to, do virtual school at the start of the pandemic, for me to work from home. I've got 2 cell phones, right? So I don't have to worry about taking calls from my personal phone. I just shifted. We easily shifted, but for families that are impoverished, for women that are, again, having to juggle those multiple priorities and that may be dependent on government service or economic benefits, entitlement programs, this has not been an easy shift for them. Their economic mobility is already lower, right? We know that based on the Chetty study, that 50 out of 50 for Mecklenburg County and for Charlotte, that their zip code has already predetermined their trajectory. And now we've thrown other barriers in their way that it's going to generationally impact their ability to overcome the impacts of COVID, for which we really don't know yet, right? We haven't started to study that because we're still in the midst of a pandemic. So specifically around the work that we do here at CareRing, we are working to try to remove some of those barriers and engage families, meet their needs. Some of them are just very urgent: food, transportation. Again, things that you or I could just go to Harris Teeter, we get in our car, we go. It definitely keeps me up at night. It's very bothersome. We should not have to choose between balancing family and a career. And I think we have definitely, for women, taken a step back, but for women who are already a step back already, it's just further put them in a place of detriment. So very concerned at how we will rebound as women in general, but for lower income women, it's going to be an even steeper uphill climb.
Thank you for sharing that and for that perspective and for bringing that voice to the table. I think that's very important. And so we have experienced shiftings And for some of us, that shifting has not been as fluid as it has been for others. There's a question that we have for the audience, and I want to ask, I'll just open this up to anyone who's interested in answering this. But they wanted to know if you can provide examples of institutional policies and or procedures that are being implemented or that you would recommend to be implemented in support of women's current mental health needs.
I think the availability of mental health services, but again, we're coming back to where your resources are. We just had a benefits meeting this morning, the health benefits that are changing for our organization. I'm within the Children and Family Services Center here uptown. So there's 12 other nonprofit organizations in our building, and most of us are in the shared services health plan. But they've offered an extra mental health benefit that's free and accessible for anyone that wants it. Is that available for the cashier at Food Lion? I don't know. Is that available for the waitress that's waiting our table for lunch, for the bus driver? We have to ask, I think the question is, are those policies equitable for all? If I have access to them, shouldn't someone else that lives in a different zip code have access to them? But I had seen in the last, since March 2020, more availability for mental health services, for counseling, for us to have opportunities for self-care. But I do not think it is the norm for everyone. And again, we're fighting stigma. Is it okay to ask for help? I saw a question, should I feel ashamed for asking for help? So I think first we have to overcome that barrier to us getting to a place where we can then embrace the services that are being offered.
All right, Dr. Lennon?
Yeah, I was just gonna add on to that. So I really, like the perspective of like the accessibility of the services and how accessible that an organization makes it. I also think I, have a lot of recommendations about looking at policies about who can. So, for example, if a company or organization provides medical or mental health coverage, is what individuals are you able to put on your plan? So for example, a lot of times this affects the types of relationships that people have, and a lot of individuals who tend to be in same gender partnerships tend to utilize the institution of marriage a little less frequently, because historically there has been a lot of heterosexism and homophobia embedded literally within the institution of marriage. And so if you are only providing opportunities for legally wedded spouses to be on it, it might disproportionately impact some communities who are not participating in the institution of marriage, as an example of that. So just wanted to add kind of that piece in it too. Oh, go for it, Dr. Dahl.
Go ahead, finish your thought.
I was gonna say, I think this is a challenge because I love the question, but I feel like I have more recommendations than I do like what's actually happening, because I don't think the things that are needing to happen. One piece I want to acknowledge is we've talked a lot about the past 19 months and what it meant for all of us to go through the initial transition. I also want to acknowledge for a lot of folks, there is a second transition that's happening now as people have had the privilege to work from home are now being asked to come back. And part of what I think about are what are the policies that are supporting that second transition, because for some folks that is just as hard, if not harder, to have to transition our life back. And what are the policies, for example, around leave? Is how easy is it to take leave if you have a sick child or somebody else that you're caretaking for, if you yourself are sick. So even if you want to make a mental health appointment and see a therapist, how easy is it to actually carve out the time in your schedule that you need to do that? And how much does your employer support that?
So these are all such great points. The one thing that I could soapbox on all day is our maternity leave policy in the United States. It's just not enough time. And so it's especially not enough time in a pandemic where mothers are even more heightened around their concern for their young child. So that would be the one thing. Like if I could wave a magic wand, that'd be it. That'd be it today, that we would shift those policies, just because my work is in pregnancy and postpartum health. And in this pandemic, I've just seen a lot. And we've done some qualitative interviews with pregnant women about those experiences, and it's just simply not enough time for them. Similar, some of the notes kind of would fall under that as well. Taking time off, and is it equitable? So if my husband's mother becomes ill, but his job does not allow him to take any time, can my job allow me to take some time to do that caregiving? So I do think it is complex, but I do think that it is important. And again, this pandemic has really shown us company values or business values. And I think that's another thing that I try to tell my students is, if it's not working for you, you don't have to work for it. And that can be challenging. And again, another point of privilege to walk away from something, but it is important to consider if it's not matching what your needs are, and if it's exacerbating any mental health issues that you're having. So for example, if you have a young child and your anxiety is really high, at the end of the day, I think you need to focus on that and ask what's most important, and is there another option? I also think that we institutionally should become more flexible with work from home. We have shown that people can do it, and people can do it well across all different disciplines. And so I've seen companies kind of adapt to those needs. And I think that's important too. Whereas working from home, if your child was sick in the past and you had to take that day off, that was a personal day, or you had to you had to go without pay. Can we just make it so that you're still doing the work, but you're doing the work from home? And a little bit less of the policing around how people are getting their work done, I think would be ideal there.
Thank you all for those comments. And you're right. I mean, it gets into a lot of the business values. We're seeing companies' values surface now, and what they prioritize as far as the equity, making sure that there's equity and equitable practices within organizations, and how they promote and support mental health for all of their employees, and particularly women. And there was another comment in our chat about childcare issues. We haven't touched heavily on childcare, but the question was, if childcare were to become a public issue or policy issue, much like education, do you believe that that would make a big difference as far as the issue of work or taking care of children? Any thoughts on childcare policy and support of those of childcare initiatives?
I see Mrs. Montgomery is unmuted, so I was going to let her go.
Yeah, well, I stay unmuted because I'll forget. I'll start talking. I think we have done a better job here within our county of making childcare accessible. When I first arrived in Mecklenburg County, I think the childcare list was like 4 years long if you needed assistance. And by that time, your child is heading off to preschool. But we've done incredible work through efforts like MEC Pre-K, where the wait list is virtually none today. The question then becomes, is there a child care spot open? Not is there assistance available for subsidy, but are there child care providers to provide the care for your child? And that is an entirely new epidemic with the Great Resignation. Childcare workers, teachers, others that do caretaking during the day, recognizing that their value is not seen. They are low income or low wage workers. And so it's been very difficult for childcare organizations or companies to remain open or be able to provide care, at least at the rate that's affordable for families. So we solved one problem, and now we've gotten to a different sort of problem where we're entering workforce development issues. So I think right now, at least in Mecklenburg County, there are policies to support equitable access to childcare, but now with the pandemic, we're having a different kind of problem. So I think we've done a good job policy-wise. The issue now is around workforce development. Are we able to pay childcare workers what they're worth? And so that people can get back to work but feel valued.
Thank you for sharing that and for responding to that question. And I know from a personal level, I have a colleague who has young children in childcare and daycare. And every time there's a COVID positive child in a daycare, it requires this employee to then be home for about 10 days with the child. And so considering the effects of that, so now we're, you all talked about that transition back in and how there wasn't a planned transition for us to go back into the office for those of us who were able to work from home. But then now you also have the consequences of children being in daycare, but not being able to remain in daycare, perhaps because there's a child at the daycare who has tested COVID positive, or a worker. Those are all issues, unexpected issues that come up that we can't really plan for until it happens. And so we find ourselves operating in constant states of just change and crisis. And that can have an impact on our overall mental health. Now, Dr. Dahl, you had started, I don't know if you realized it or not, but you started talking about some of the lessons that we've learned from COVID and some of the takeaways from this. And I think, Dr. Lennon, you were the one who mentioned the transition back to work, how perhaps there should have been better planning for that. When we think about women's mental health, what are some of the lessons you would say that we have learned or are learning about how to prioritize the needs of women as far as our well-being psychologically and emotionally?
Sure, so I'll kick it off. I think, I've touched on quite a few things to consider, but I think that women have seen this crisis kind of affect folks differently. And so I think it has helped us as women understand what situations people are going through. And so I do not have any children. So my experience looks vastly different than somebody with children. And so if there was a question in the chat around grace, and I think I've always had grace for moms, but the amount of just more understanding of those circumstances where, they are needing more time off of work, or I'm not getting a response from an email right away. Those things are okay. And I think, I hope that men are also becoming more aware of the emotional and the physical and the structural load that women kind of take on in the household, traditionally from the socialized experience. So that would be one thing. The other point that I want to make is prioritizing mental health. So mental health and physical health, I think, are things that have surfaced as major issues during the pandemic, regardless of gender. And so I think that for women, remembering that routine visits to the doctor should be a priority. We're seeing screenings for breast cancer awareness, or for breast cancer, decreased in the past year. So there is way more this October in terms of a push to get people back in the office. The other thing is that in food insecure households, women tend to be the last person to eat. And so remembering that to show up in a good mental health space, a lot of times you have to have a good physical health. And so remembering that, taking care of ourselves so that we can show up stronger for the people in our families or for the people in our social networks, that's important too. Those are just kind of two thoughts to add on to the other points I shared earlier.
Yeah, I can kind of add in too. I think for me, probably one of the biggest lessons that I'm hoping people take from this is that women are not a monolith. Is that while I think sometimes we are seen as homogenous, I think sometimes we see each other as homogenous. That is absolutely not accurate whatsoever. Dr. Dahl, I appreciate you naming the empathy you have for mothers. It has been a thing. I can't even begin to tell you what it has been like to have a little one at home. That could take the entire hour, so I won't. But I'm sure there's things you have, Dr. Dahl, that have complicated this process for you that I had the privilege that I didn't have to endure these past 19 months. So it's all different, right? But as I think about the transition back, the piece that I always think about is what it means to come back. What does it mean to come back to a work site that a lot of times is embedded in, for example, white supremacy, that is embedded with structural racism, with individual racism, with homophobia, with heterosexism, with sexism, with misogyny, all the pieces that different individuals who identify as women also have to be able to manage on a day-to-day basis. And one of the things we've had a lot of conversations about is, even though structural racism and homophobia and misogyny do not leave when a lot of us were able to transition, is if you were able to transition, one of the privileges I think that carried is if you're on a Zoom call and somebody drops something that's incredibly racist or homophobic. If somebody drops something homophobic, I know for me, like, I would mute my video because I'm just like, I can't. Like, as a queer woman, I'm just like, I can't do this right now. But I had that option to be able to do that. As I have transitioned back into it, if I'm sitting in, you know, a meeting that people are doing in person, I mean, I could get up and leave, but there's probably also different consequences if I get up and leave. And so what does it mean to come back to a work site that has this structural and individual oppression embedded within it? And what does it mean for Black, Indigenous, and other women of color to be able to have to deal with the day-to-day racism in a way that for some women have talked about feeling more pronounced now, or for queer and trans women dealing with the transphobia and the homophobia. And then for a lot of women that have sort of an intersection of those identities. So I think that's the piece. And the piece that I would say too is I think this is a responsibility of all genders, but I think for us as women, I think sometimes, particularly, I'm going to speak to white women, I'll speak from my experience. I think us white cis women, a lot of times, I think we get very sort of connected to what it means to be oppressed as women, because that absolutely exists. But I think sometimes we lose the focus on, as white folks and as cisgender folks, what is the role and responsibility that I have to be able to ensure that I am advocating and I am speaking up for issues that women of color are telling me are important to them, that trans women are telling me are important to them, because I have that particular privilege and I have a responsibility to do that. So I think that's the other lesson, is knowing that things disproportionately impact me as a queer woman, but also I have aspects of privilege that I need to be able to find where my role and responsibility is to advocate for these policies and procedures that are disproportionately impacting other women.
Thank you, Dr. Lennon, for your awareness. That's where I think it starts, right? Trying to analyze our own selves and what privileges we have. I have certain privileges, but I'm still a Black woman at the end of the day. I always say I'm Black first, right? Even sometimes before I'm a woman, if I'm being honest. And that does impact my family, my career, my experience in life. I think to your point about going back, I think that's part of grace, right? Rethinking our expectations of what we're going back to. If we need to go back, Dr. Dahl, you talked earlier about people do I even want to do this anymore? And wondering, are they in the right career? Are they in the right profession? Are they surrounded by the right people? So we have this massive movement, I think, that's been forced upon us that otherwise, minus a pandemic, I don't think we would have arrived here as sooner to that place. It is a huge disruption, but in the best sort of way. Disruptions are healthy, they're good, they're going to move us into a place of change. It will be painful. It is painful now, but I think it's going to get worse before it gets better. I will say that especially with BIPOC people, there's this natural resilience because they've already faced so much, right? It's a daily challenge. I wake up every day. I've done these amazing fishbowl activities with a number of organizations where, we if you haven't participated in one, find somebody to facilitate, but you've got usually BIPOC people in the center, in a circle, talking to one another about what it's like to be in your experience. And then you're surrounded in an outer circle with usually people that are not of that race, so usually white people. And then the conversations that happen every day, I wake up and I am faced with the fact that I am Black, and it impacts my experience from the time I wake up until the time that I go to bed. And so that awareness every day is not something that all experience. So how, to your point, Dr. Lennon, how do we get more people to do that, to exercise that inner analyzation and reflection on how am I being impacted by this pandemic in my health versus others? Women in general, yes, we sacrifice more. We are the last ones to eat. A third of women during this pandemic have foregone medical treatment, recommended treatment, doctor's appointments versus a quarter of men or less. And of course, those numbers increase as we get to women that were already in poor health which chances are women that are disproportionately impacted by other areas of life, so race and poverty, things of that nature. So while we are resilient, we're getting burned out. Some people are getting burned out at a much higher rate. And I think the gaps that we saw before, they're going to continue to widen. So trying to reflect on what we can each individually do to try to lessen that impact, I think, is all of our responsibility.
And I appreciate the conversation and bringing in that intersectional lens and perspective to this, because we know, as Dr. Lennon stated, we're not a monolith as a group of women. We have our varying intersections, and those impact us very differently. So for some of us, we are not only, of course, dealing with the pandemic of COVID, but we're dealing with a pandemic of racism. We're dealing with other pandemics that are happening in this country. And so it ends up being a layering of oppression that we're experiencing. And so I appreciate bringing in that conversation and discussing that. When you talked about the showing back up into this space and transitioning back into places, it made me think about for those of us who were able to work at home, particularly those from an intersectional perspective as it relates to women, home became, for some of us, a place of protection from having to deal with the ills of the workplace and some of the oppression in the workplace. And so, Dr. Lennon, as you mentioned, we could mute our video when we experience perhaps a microaggression. I've done that plenty of times when I've been in meetings and I felt uncomfortable. I could mute the video and I could step away for a second. And so that offered an area of protection for me in my home. Now that we're going back into these spaces, institutions, organizations, and businesses, perhaps where we're feeling that oppression again, my question for you all as a group is, what strategies can we implement as women, or just in general, to now go back into these places where there perhaps are the microaggressions and the oppression that we're experiencing? How can we stay in these places if we choose to stay and remain well when perhaps working from home is not an option for us anymore?
I can give one example that's pretty specific. So during the pandemic and, in the months that followed, when there were racial tensions throughout the country, and I think even within the spaces that we operate our day-to-day, like the more micro spaces that we're operating in, one of the things that came about was me finding other women who I knew could help, like building a network of people who would not be afraid to speak up when something came up in a Zoom or in a department meeting, or working with community partners. And like we formed a pact that was essentially like, I've got your back. So this kind of finding solidarity with other women or with other allies that we can start to call out and name the things that are not okay anymore. And I think that people generally feel safer doing so. Yes, racial tension is still on. I see in the chat there too. That's where it kind of like built up for us, is when it was layers and layers of things that were not okay, and we were not kind of we didn't feel confident responding to in a safe way. That's when we found kind of support in each other. And so women are super powerful beings. And if we can kind of form those connections and kind of make a pact that, says, this is not okay, this is not what we're going to tolerate, how do we actually respond to it, was helpful for a group of people in my department. And we actually did come up with a plan for how to actually respond to it, instead of letting the Zoom end and then us kind of all just brewing with whatever that issue was. So that was one pretty specific example of how folks in my department responded.
May sound cliche, but I was thinking about this concept of like, it's okay not to be okay. And again, going back to the socialization piece, that we have been socialized to be able to do it all and still keep going. I was thinking, when I was thinking about this, I was thinking about, I have not experienced this directly as a white woman, but I was thinking about a lot of Black women in my life, and a lot of clients I work with who identify as Black women who talk about that superwoman syndrome is like this sort of like pressure that is put on. And I think a lot of times it's intended as a compliment. It's one of these examples of like, we intend as a compliment, wow, you're really superwoman, but it puts these like unrealistic, expectations, particularly on Black identified women and other women of color, that you should be able to do it all. And it doesn't allow the flexibility to like not be okay. And so one of the questions I might ask for each person in this space, particularly the women identified people in this space, is, do you have spaces? And if so, where are they, where it is okay not to be okay? I will say, and I kind of smile when I say this, is there are a couple of participants on this panel who are my space that it's okay not to be okay. And they mean the world to me, and they are other women identified individuals. And I also hope to become the space where it's okay for them not to be okay. But I feel like if you can't answer that question and you don't have a space where it's not okay to not be okay, then to me, that becomes part of the task, is figuring out why might that space not exist and what might it mean to try and cultivate that space for you, because the space may actually be there with people who want to hear you, but there may have been so much training in your life of not sort of opening yourself up and being vulnerable, because that sometimes I think can be very scary.
No is a complete sentence. And I have gotten better at saying that. Or my favorite phrase is, I'm sorry, I don't have capacity right now. So making sure I'm setting boundaries for myself and what I will allow myself to take on. I am naturally a networker and a giver, and my plate will be full, giving, and then I am recognizing that I'm not getting a lot in return, right, to replenish myself so that I have something left at the end of the day for those that I love and that need me. So finding a way to be present, but present with boundaries and with balance. And we keep coming back to grace, right? And do I extend that to myself as well as to others as well? But I think that's very important for us as women to learn how to do, to say no, and that's okay.
Thank you all so much for your comments, and you've given me great insight and ideas and strategies, and I feel uplifted. And so thank you so much for sharing that. And I hope our listeners today will take some of the tools and guidance that you've provided, including finding your group, finding a group of individuals who will support you and speak up for you and have your back, and also extending yourself grace, as we mentioned, as well as understanding we are all shifting. We are going through very difficult times, unexpected times. And so it's okay to not be okay, as Dr. Lennon stated. Thank you all so much for your contributions.
I want to say hello again and thank our panelists again for a wonderful discussion. I said at the beginning that there was a lot to be gleaned from their expertise and from sharing their own personal stories. So thank you so much for your vulnerability and for your openness. Thank you for reminding us that rest is a priority and not a reward. And we need to reframe our understanding of what rest is, and that we need to make it a priority. Thank you for helping us to understand and get a deeper understanding of balance and what that is. And we get to decide that for ourselves, looking at intersectional issues. Thank you so much. Thank you for reminding us that, women are providing daycare and elder care for their parents and other family members. Thank you for highlighting the importance of women managing their own mental health care while they're caring for others. I want to thank our panelists again, Dr. Sonyia Richardson, Dr. Erica Lennon, Dr. Alicia Dahl, and last but certainly not least, Tchernavia Montgomery. Thank you all for sharing your insight, your wisdom, and your expertise. Again, a poll should pop up shortly for you to take, just giving us your feedback about today's session. Again, everyone who participated in today's session will receive a self-care box you will have that sent to you. So thank you so very much for your participation and for your attendance. For those who are not able to attend, this session will be posted on our website, Women and Girls Alliance at charlotte.edu. That will be posted by Friday. So if you missed part of it or were not able to attend it, you will be able to review it again and share it with those who you think would benefit from this discussion. Again, thank you so much. Thank you to our panelists, and we look forward to you joining us again in the new year. And take care and be well. Enjoy the rest of your day. Thank you so much.